Heart attacks are like bad Wi-Fi, unpredictable, inconvenient, and they always show up at the worst times. But unlike your router, you cannot just reset your heart with a quick reboot. So let's dive into what really puts your heart at risk before it decides to disconnect without warning. Number 10. Stress. The silent killer. Imagine you are stuck in traffic, running late for a meeting, and the car in front of you is moving slower than a snail. That rush of anger you feel? Yes, that is stress. And it is not just an annoyance, it is a risk factor for heart attacks. When stressed, your body releases hormones like cortisol and adrenaline, causing your heart to beat faster and your blood pressure to rise. Chronic stress can lead to high blood pressure, one of the primary contributors to heart attacks. Additionally, stress can lead to unhealthy behaviors such as overeating, smoking, or drinking alcohol, which further increase the risk. Stress management techniques like yoga, meditation, or even just a good laugh can help reduce these risks. Yes, laughter might not solve your problems, but it can give your heart a little vacation. Number 9. Poor diet. The fast track to heart trouble. If your diet consists of double cheeseburgers, fries, and sugary sodas, you are basically putting your heart on the fast track to trouble. Diets high in saturated fats, trans fats, and cholesterol can lead to plaque buildup in the arteries, restricting blood flow to the heart. This buildup can lead to atherosclerosis, the narrowing and hardening of arteries, which is a leading cause of heart attacks. Excessive salt intake can raise blood pressure, another heart attack risk. Conversely, a diet rich in fruits, vegetables, whole grains, and lean proteins can help maintain heart health. So the next time you are tempted by that double bacon cheeseburger, remember that a salad might not be as exciting, but your heart will thank you for it. Number 8. Physical inactivity. Couch potato syndrome. A sedentary lifestyle is another major risk factor for heart attacks. When you are inactive, your risk for high blood pressure, high cholesterol, and diabetes increases, all of which are risk factors for heart disease. Physical activity helps to strengthen the heart, lower blood pressure, and reduce stress. It does not mean you need to run a marathon. Even moderate exercise like brisk walking, cycling, or swimming can make a significant difference. The key is consistency. So instead of binge watching your favorite series for hours on end, consider taking short breaks to move around. Your heart is a muscle, and like any muscle, it needs regular exercise to stay in shape. Do not worry, your couch will still be there when you get back. Number 7. Smoking. A heart's worst enemy. Smoking is one of the most preventable risk factors for heart attacks. Every puff of a cigarette introduces harmful chemicals into your body that damage the lining of the arteries, leading to atherosclerosis. Smoking also raises blood pressure and reduces the oxygen that gets to your heart, forcing it to work harder. Even exposure to secondhand smoke can increase your risk. The good news? Quitting smoking has almost immediate benefits. Within a year of quitting, your risk of heart disease is cut in half. It might not be easy, but think of it this way: your heart would love a break from constantly feeling like it is in a boxing ring. Number 6. High blood pressure. The stealthy saboteur. High blood pressure is often called the silent killer because it usually has no symptoms but silently damages your arteries over time. When the force of blood against the artery walls is consistently too high, it can damage the blood vessels and the heart, increasing the risk of heart attack. Managing high blood pressure is crucial for heart health. This can involve lifestyle changes such as diet, exercise, and stress reduction, and sometimes medication. Regular checkups are essential because the only way to know if you have high blood pressure is to measure it. Think of it as regular maintenance for your heart, much like you would for your car. After all, you do not want your heart engine to break down unexpectedly. Number 5. High cholesterol. The artery clogger. High cholesterol levels, particularly low-density lipoprotein cholesterol, can lead to the buildup of plaques in the arteries, narrowing them and making it difficult for blood to flow to the heart. This condition, known as atherosclerosis, is a leading cause of heart attacks. The plaques can rupture, leading to blood clots that block blood flow to the heart. A healthy diet, regular exercise, and medications, if necessary, can help manage cholesterol levels. Regular blood tests are crucial to monitor your cholesterol levels. Remember, cholesterol is like that uninvited guest who crashes the party and makes a mess of everything. It is better to keep it under control before it takes over the whole show. Number 4. Diabetes, sugar's dark side. Diabetes is not just about sugar. It has serious implications for heart health. High blood sugar levels can damage blood vessels and the nerves that control the heart. People with diabetes are more likely to have other conditions that raise the risk of heart disease, such as high blood pressure and high cholesterol. Effective management of diabetes through diet, exercise, and medication is essential to reduce the risk of a heart attack. Regular monitoring of blood sugar levels is also crucial. It is like having a mischievous friend who causes trouble when left unsupervised. Keeping an eye on it can prevent chaos. Number 3. Obesity. More than just a weight problem. Obesity is more than just carrying extra weight. It is a complex health issue that significantly increases the risk of heart attacks. Excess body fat, especially around the abdomen, can lead to high blood pressure, high cholesterol, and insulin resistance, which are all risk factors for heart disease. Losing even a small amount of weight can have a significant impact on heart health. A combination of a healthy diet, regular physical activity, and behavioral changes can help manage weight effectively. Think of it this way: your heart is like a car engine. The more weight it has to carry, the harder it has to work, and the sooner it is likely to break down. Number 2. Family history. The genetic hand you are dealt. Your family history can play a significant role in your risk of a heart attack. If heart disease runs in your family, your risk of developing it increases. This does not mean you are destined to have a heart attack, but it does mean you should be more vigilant about managing other risk factors like diet, exercise, and stress. Regular checkups and early screening are important if you have a family history of heart disease. You cannot change your genetics, but you can change your lifestyle. Think of it as playing the cards you are dealt. You might not have the best hand, but how you play it can make all the difference. Number 1. Age and gender. The inevitable risk factors. Finally, age and gender are 2 risk factors you cannot control. As you age, your risk of a heart attack increases. Men are at higher risk of heart attacks at a younger age, but women catch up after menopause. This does not mean young people are immune. Heart attacks can happen at any age, especially if other risk factors are present. The best defense is a proactive approach to heart health throughout your life. Regular checkups, a healthy lifestyle, and managing other risk factors can help mitigate these risks. Aging might be inevitable, but a heart attack does not have to be. It is like getting older. You cannot stop it, but you can certainly age gracefully. Your heart deserves that effort. Thanks for sticking with us all the way to the heart of the matter. If you found this video helpful, don't forget to hit that like button and subscribe for more health tips, served with a twist of fun and a sprinkle of positivity. We've got plenty more insights, surprises, and tips to keep you feeling your best. So join us on this journey to a healthier, happier you.